Unfortunately, this doesn't seem to change anytime soon. It seems like the priorities of Washington are not in the best interests of physicians, hospitals, caretakers, whether that's elder care or hospital care. What's more, it seems that with the way our healthcare system operates, extremely for-profit, with the liaisons in the health insurance industry dictating terms to both hospitals and the patients themselves, the fact that nurses and doctors tend to be overworked and completely underappreciated, it is becoming readily apparent that this crisis will continue unabated unless something is done. The state of Illinois itself has over 12,000 nursing shortages in its state. Then this is repeated all across the country. Travel nursing is a temporary, short-term solution to this problem, but it is not enough. We need stability in our healthcare systems. We need the ability to take care of the elderly and, of course, children and everyone else who needs access to healthcare. Which is why, as president, the focus should always be to empower the citizenry, to make healthcare more accessible. And that means substantial reform to our healthcare systems. That means we need to truly start talking about universal healthcare as an actual solution to the problem. And yes, that means eliminating the entire health insurance industry. And yes, that means bringing healthcare back to the public sector. And yes, that might mean raising the income tax cap so that Medicare is uncapped in its taxable income. That way, healthcare costs will forever remain solvent. And in so doing, we can take one of many steps necessary to address this healthcare concern. By making it publicly owned, we can ensure and guarantee specific wages, standards, and opportunities for nurses, for doctors, and for everyone else in between. By standardizing the cost of care, it won't be a shock to the patient nor to the administrations of the hospitals as to where their dollars coming from to keep the facilities running and the people employed. If we address this issue intelligently, logically, dare I say, we can resolve this staffing shortage immediately. And as your future president, that is precisely what I would do.